My name is Peter Ferry. I'm the CEO of a company called Sika. I'm based in Edinburgh, and I've asked the other members of the panel to give me an interesting fact about themselves. My own interesting fact is that as we're talking today about the issuing of credentials and certificates, I also, in a part-time job, issue travel documents and identity cards, because as well as being the CEO of Sika, I'm also the Honorary Consul of Estonia in Scotland. Now, today's discussion is about the hope, I guess, that coronavirus vaccination, now that it can offer some hope that normal life can resume post-lockdown. There are still some serious risks of outbreak in the foreseeable future. Now, we shouldn't forget that in the UK, we marked yesterday the 1-year anniversary of a series of lockdown events, and there's been tragic loss of life and livelihoods that followed. And today we're talking about some of the systems that can potentially manage some of these risks, popularly those systems that might be put in place at borders, but also perhaps inevitably in other industry sectors like hospitality and education, and really wherever individuals need to be in close contact with each other or access shared spaces. Now, these systems, some may feel are inevitable, vaccine passports and other derivatives, and all our lives may be impacted by them. So technology solutions have rushed in to address some of these requirements, but there are concerns that perhaps in returning society to normal, there are some unintended consequences for privacy and personal freedoms in sharing some of this data. And that's really why today we have assembled the group of leaders that you have before you who are going to debate and discuss some of the technology, public health, the privacy, the ethical issues that society have to balance in building the next generation of health systems that can manage the COVID pandemic and future pathogen threats to global health. So, as I said before, I'm the founder of Sika. My company deliver cross-organizational distributed ledgers to secure data and improve outcomes for citizens. And we work across the public sector in education, in health, in social care, and in local government. My own background is in the IT industry, and I'm formerly an author of the Scottish Government publication, Distributed Ledger Technology in Public Services. But my role today is purely as a host and to steer the discussion. I'm joined today, firstly, by Dr. Edgar Whitley, who is who's waving now, and he is an associate professor at the LSE, the London School of Economics. His interesting fact today is he is between lectures. He's just delivered a lecture on open data and has to sprint off to another lecture immediately after this. Edgar's credentials here is he's been working around strong identity systems for over a decade with UK government and several international governments, and recently contributed to the Ada Lovelace Institute's review of the efficacy of vaccine passports. Secondly, we're joined by Marie-Elise Ferry. She is the e-health lead for Sika. She today is based in Dundee, and interestingly for her, she's actually working at the moment as a vaccinator. Her work for Sika involves contextualizing the decentralized trust technologies around managing data and citizen consent in health and social care. And she's the author of a document around COVID-19 transmission risk certification, which argues for dynamic certification of transmission risk based on vaccine and testing, which I'm sure she'll talk about as we move through this. Next up, we have joining us from Dublin, Anthony Day, who is a blockchain partner with IBM. And I believe Anthony is a partner in the IBM UK organization. And he leads some of the transformational technology, which includes blockchain. And he is the author of, the interesting fact about him is he's the author of a very interesting podcast called Blockchain Won't Save the World. I'm looking forward to hearing him talking about sharing some real world examples around IBM's work in vaccine credentials in Europe. And last but certainly not least, we have Dr. Ein Arvidsson, who's joining us from Tallinn today. Now, especially interesting for Ein is that he has a medical doctor background, and he's got one foot in the camps of medicine and in IT, and has done so for the past couple of decades. He's got a stellar curriculum vitae that includes tech entrepreneurship, and he's worked at the highest senior level in the digital public administration of Estonia, but joins us today in the context of being Chief Medical Officer for GuardTime, who are a software company with a platform that enables trust across organizations. And GuardTime have worked in piloting a smart vaccine certificate in the Republic of Estonia and have some commercial offerings which which Ein will also talk about. So in a normal interactive setting, we would now pause for applause whilst I asked you to thank your panel, but we'll just have to settle for the Zoom clap symbol, which you might find towards the bottom of your Zoom window. And I'll move straight ahead to kick things off with by starting to discuss some of the guidance around vaccine passports that we have started to see from the World Health Organization. The World Health Organization published some interim guidance around vaccine passports just earlier this week. At the end of last week, in fact. And their context was really around the interoperability of documentation around vaccine status, which they call smart vaccination certificates, SVCs, with a context which is certainly about COVID first, but taking a more foundational approach for interoperability around the world. The use is about presenting a vaccination document which allows its owner to claim they've received a vaccine, which can be verified by that vaccination source, with a context around continuity of care and defining multiple types of use for that vaccine certificate, which we'll go on to discuss. And in that document, it positions the World Health Organization as a trust broker and takes a very much an agile approach over the coming months between now and June around seeking consultation with international governments to define how such systems can move forward. So with that background, I'd like now to turn to the scope and the utility of vaccine passports and more generally of COVID health status certification. So I'll turn first of all to Edgar Whitley, who's been waiting patiently. So Edgar, as we start to I'll kick off with the question of if we start to understand the effectiveness of the vaccines which are now being delivered into the community, what is the context? What's the question that COVID status certification is the answer to, and how can it be used in society?
So I think that's a really good question, because it really pushes at the heart of what it is that we are trying to use this technology to actually achieve. So it's interesting that you talked about the World Health Organization's guidance around proof of vaccination. Now, proof of vaccination is an important part, but of course, that all that effectively tells us is that you've had a vaccine stuck in your arm, and at a certain point in time, which vaccine, which batch, et cetera, et cetera. If we're thinking about using that information as part of opening up our societies back to a more normal situation, then of course there's an important distinction between the fact that you've been vaccinated, which is ultimately a personal, the main benefit is personal. The vaccines seem to suggest that the likelihood of severe illness, hospitalization, and possibly death is much reduced for those individuals who've been vaccinated. And that clearly has important consequences for healthcare management, etc. What the scientific evidence is much less clear about at this point in time is what effect vaccination has on the transmissibility of the disease. Now, everyone is hoping that people who have been vaccinated are also less transmissible, but that's the point that becomes really important for reopening society over and above the relaxation of restrictions that different countries are going to have at different points in time. So if you've been vaccinated, what does that then tell us about what you can do more freely in society? And I'm lucky enough, or I'm old enough to have just been vaccinated in the UK, and the guidance basically says, at the moment, you will still be expected to do social distancing, you'll still be encouraged to be mask wearing, etc., because we simply do not know what the long-term effects in terms of transmissibility are going to be. And so if you're thinking about using this status for reopening a domestic economy as opposed to international travel, I'm unclear as to what additional benefits you are going to get. So if the pubs or pub gardens are reopening from April the 12th in the UK, which is the current plan, and I could sit in the pub garden in groups of 6 outside in the cold, because it will still be cold in the UK, what difference will it make that I've been vaccinated or not? Will I be allowed to sit more closely to my friends? Will there be half of the beer garden for the vaccinated people to sit close to each other and keep warm, and everybody else to sit more far apart? So really working through what that would mean in a domestic context for at the point where we do not know, even if we expect that vaccination will also affect transmission. So I think that's a really useful starting point for understanding what the normality is that we're aiming for.
Thanks very much, Edgar. That's very interesting. So the potentially unclear whether vaccination status actually can help us reopen some of these industries that are mentioned in the preamble. Just as a further question, what it might be what's the status on our learning and our research around understanding at some point in the future if we might have better information about how vaccination impacts transmissibility?
So all the expectations and all the hopes are that vaccines for COVID will act in very similar ways to other vaccines that we already have that will limit the extent of transmission, but formally, we just don't know at this point in time. And for countries like the UK, if additionally we've managed to do a very successful vaccination rollout, then the risk of people being infected, if it is slightly more transmissible than we hope it's going to be, again, the consequences for the healthcare system will still be limited because most of those people won't end up being hospitalized, etc. So the UK, with its timing, is in a very particular position that other countries around the globe, I know, don't then need to do that. So there's a question just come: would a vaccination proof allow me to not register in a restaurant. So I think there's a couple of points there. So would it allow me to not register in a restaurant and give up personal information? Well, if the restaurant is already doing socially distanced service, then I don't see what additional benefit you're going to do. What information you're giving? Well, at the moment, certainly in the UK, you're just checking into these locations, and that data is only used for contact tracing rather than sharing more personal data. Taking time off work, again, it's not clear what evidence you're collecting, but just proof that you've been vaccinated just means that you are unlikely to be hospitalized. That doesn't mean that you won't get sick, and it possibly doesn't mean that you're not going to transmit the disease, even if you're not going to be hospitalized yourself.
Yeah.
We really have a lot of scientific uncertainty at this point.
At this point, okay, thank you. And just to finish it on this topic, turning to Miss Ferry, what's your feeling on the beyond vaccination? What's the broader context of COVID and other pathogen health status and its verification and role in reopening the economy?
Well, I think it largely remains to be seen, and specific challenges are going to present themselves as we begin to open things up again. So, I mean, society's not been opened up in a significant way really since the start of lockdown, maybe to some extent down in England during the summer. There's a rush at the moment to get solutions in place, but I think COVID and other pathogens of zoonotic origin are the long haul, and we need to start thinking in that way. So it's not necessarily how are we all going to go on holiday this summer, but rather how are we all going to continue to move and interact safely over the next 10, 15 years and into the future. COVID started in the UK with a handful of imported cases, and here we are a year later, we're still in lockdown. So I think an important point to sort of focus on is preventing even one avoidable transmission event is actually important to the ongoing public health of the entire country and globally. So one imported case or one transmission can lead to a whole country shutting down, and that's just unfortunately how these diseases work. So a combination of vaccine and testing status might indeed facilitate easing of restrictions, opening of public life. But as Edgar was saying, vaccination doesn't necessarily confer immunity. We don't know about the impact of transmission. When we look at testing, there's a variety of tests available with different levels of effectiveness. So it's going to be about those levels of risk, what's acceptable for a large-scale outdoor event versus indoors at a cinema or a wedding. The UK government's currently running an events research programme to study the impact of more intensive testing for larger scale events, but there's practicalities to this and how the sensitive information will actually be shared securely with the venue or the relevant party in question. So there's a lot of unknowns, but I think we need to focus going forward on avoiding forgery, preserving privacy for the individual, and also making it simple for the end user, because at the end of the day, nothing's going to work on a global or a national scale unless it's simple at the point of use.
Thanks for that summary, Marion. I think also your earlier point there that the nature of the systems required might change as we get into later stages of the pandemic and are dealing perhaps with, apologies if I use the wrong language, with smaller outbreaks more than a more endemic situation. Okay, so shifting on and moving to Dr. Arvidsson and Mr. Day, I'd like to discuss, gentlemen, some of the recent developments from around the world, and particularly with your organisations globally, around vaccine passports, supply chains, and health certification. So, Dr. Arvidsson, firstly, can you briefly tell us about your work in Estonia with GuardTime around vaccine credentials and pharmaceutical supply chains?
Yeah, thank you. Yeah, Gautam is working in Estonia and talking around 40 different countries and piloting it in 10 countries. So we also have already, on one hand, understanding from many of those countries. But when we started working a year ago, basically with the WHO, it was not about COVID in the first place. It was really trying to introduce the idea that distributed stakeholders can collaborate, and also in an area as sensitive as healthcare, in a manner that they build workflows which are cross-boundary, cross-country, or even between health systems, and then yes, indeed, supply chains. And yet, after the COVID pandemic started, we kind of focused more narrowly on how to mitigate the risks from this disease. Now, I will answer in kind of two parts. So I still am a public health person. So from the public health point of view, really the passporting use case, really, it came quite late in the discussion. So the first discussion was what is most often called the care continuity use case, whereby you might get your first vaccination in one location, you then would like to go to another one, then there is another healthcare professional whom you would like to share your data. They have some liability risks, knowing something about your past, and that use case was kind of obvious and nobody doubted that. But there's still, you still need to make some precautions in terms of security and privacy, and Gautam has a cool tech which is capable of rendering all of that. And then gradually, and I think over the last 4 weeks, a switch happened, and nobody's talking anymore about the health use cases, and everybody's talking, oh, I want to travel. And then I give you a little bit, as a company, we also internally discuss, our solution primarily is focused on the governments to actually have effective vaccination campaigns, so that not the document as the certificate, but also the information therein. So how do you know that this is authentic vaccine in the first place? That was captured into that document. If we still believe that this need will be there over the next 4 years, but we just heard all the politicians are promising to Europeans that by the end of July we will have herd immunity, and I absolutely agree with Edgar. So if from the public health point of view, each new individual infection doesn't pose anymore that much of a public health risk, what is the added value of trying to organize and building enormously complex system to manage the privacy of a value proposition that has been defined so narrowly? So I will summarize in telling that I think we should try to make the best use of the technologies which enable securely and privately kind of collaborate people, organizations. Am I fighting for my right to get to the pub or to a concert and building the world's best security passport from Gautam? No. I really think that I can contribute to the public health more than I'd like to go to pub and visit my favorite city, London. But yeah, I don't know where this all leads. I've learned a lot of things, and I think that we can provide a lot of value to the governments, to the citizens, to pharma manufacturers, in order to get better understanding, efficiency of those vaccines with the use of data. But yeah, vaccine passports to open up the economies. I know many people hope that will be the case. Maybe for this summer. Next summer, I'm really doubtful.
Thank you, Arjen. Okay, that's an interesting view. So really secure collaboration across the entire public health ecosystem. So just turning to Anthony now, who on my screen is on mute anyway. Anthony, could you explain to us a little bit about how your organization, IBM, have been working with HealthPass and some of the work that you've done on the continent?
Yeah, for sure. And thanks to the other colleagues for kind of building in some of the context in the background here. I mean, first things first, let's understand why are we doing this, first of all, because it's not that we want vaccine passports or health passports because that's something that's required. What we're saying is that there is a requirement for verification of health status. There is a high likelihood that solution should be digitized as much as possible, because that will enable things to be managed in a streamlined, remote kind of way. Think about having to manage, hundreds of thousands of paper documents going through an airport. At the moment, you've got something like 95% of the operational staff on check-in desks for 20% of the passengers, because each of those individuals are carrying probably 5 different types of document: their health certificate, their forms that they need to complete for departure and arrival, their proof of identity, their proof of accommodation, etc., etc. Those 5 documents all need to be checked, and in most cases that's manual today. It is entirely unscalable to do that in that manner as we start getting back towards even 50% of air traffic. And we haven't even got into the verification in other customer journeys or in other workflows and elsewhere in industry or in sport, entertainment, or academia. So there is a high likelihood that a digital solution is going to be necessary to help us manage this verification process. It's also important then to manage the issuance of credentials. And let's be clear, it's not just vaccination. So there will be some in society who will not be able to become vaccinated. There are some in society who will choose not to become vaccinated. We should have an accessibility opportunity for those individuals who do not have a vaccine. So we're looking at vaccines, tests, and proofs of recovery as much as we're looking at just vaccination. So let's take that off the table at the moment. This is about health credentials. It's not just about vaccines. The next part of the story is about the integration. So Mr. Avuxo also talked clearly about the government angle to this. How is this being provided at a national level? But if you're an airline, or if you're an employer, or if you're a cruise line, or if you are a sports stadium or a theatre, it is entirely likely that by this summer, you will be looking at private sector and public sector wallets being issued from multiple jurisdictions: national solutions, public-private solutions, some by private healthcare organizations. And how are those going to be integrated into their digital experience, or their ticketing solution, or their entry and access management? A big part of the work that we do is actually enabling not just IBM's digital health pass, but the health pass credentials of other solutions that are out there. For confidentiality, I won't name the guys we're working with at the moment because it's not been announced publicly, but we're working with most of the the private sector wallet providers that are scaled. And scaled is a very relative term also, right? If you look at a lot of the work that's going on with airlines, most of the infrastructure around some of the other health passes are being built while the plane's in the air. To use a technology metaphor, we do not have, for some of those other providers, infrastructure that has been scaled to hundreds of millions of users across multiple jurisdictions. They've just about figured out 9 months ago that QR codes on an app is a good idea. Now let's figure out how we do scalable infrastructure under the surface, which is actually something that IBM knows a thing or two about and has been doing since pre-pandemic. So the challenge here is one of digital transformation. There's a huge challenge around policy, privacy, accessibility, and being able to provide also solutions for those people who are less digitally enabled. So there are going to still be physical paper journeys. There's sensitivity around the concept of ID cards. So this is really about public-private partnership around both policy development and user journey development, and then integration, so that the concept of digital boarding passes is very familiar to most. The level of digitization, the amount of smartphone penetration in most nations, not all, in a large amount of the areas where mass gathering occurs, is going to be prevalent, but not all. So how do we make sure we enable as much of that as possible while being as inclusive as possible to cover other jurisdictions, other geographies, other use cases, refugees, less developed nations, low bandwidth, low internet penetration countries and domains? It's a lot, but we can do a lot with the early stage digitization.
Very interesting perspective, Anthony. I'm hearing, digital to address the paper chase with accessibility and integration, and the importance of public and private partnership, not just government. So it's a very interesting viewpoint. But I'll turn, if I may, to consider some of the privacy and trust and ethical issues that you've talked about. I think there's probably evidence throughout Europe that vaccine programs, and in some cases government systems, have low public trust. The particular example I'd consider in the UK was that of a failed centralized contact tracing approach, which probably showed public opinion more in favor of decentralized systems with strong privacy foundations. So I'll turn back to Dr. Whitley and ask him, although it's an enormous topic, Dr. Whitley, what's your view of the dangers of abuse of such systems for vaccine status and the wider sharing of health status in the COVID pandemic? What's your kind of summary of the real dangers and risks here?
So I think this is, and it's following on from Anthony's point, this is where you really get into the technical details about what data you're sharing, how it's being used, etc., etc. So somebody already asked in the questions about, will I be able to go to restaurants without sharing my personally identifiable information? Well, if we are talking about the vaccine that you receive that's linked to your personal identity, because of course there's an issue of if it were to become important to prove that you've been vaccinated and you haven't yet been vaccinated because you're perhaps too young or you've got other reasons, then maybe you can use somebody else's vaccination status. It's about tying it to identity. But let's assume that you're doing that, you share that with the hospitality owner or whatever. Are they just going to check, yep, you've been vaccinated, and for whatever risk profile we've got, we're fine to let you into the busy part, the place where you can go, or whatever? Or are they going to keep a record of you entering that location with your health data? And if they're keeping that record, the monetization opportunities to analyze that. We can see that this particular pub is very popular with people in their 60s who were vaccinated in this location and therefore probably have got that home address. This person seems to be going into 12 different pubs in one evening, hopefully not requiring a substantial meal in each one. And therefore, perhaps we'll share that aggregated data with a health insurance company who might suddenly spot that there may be a health risk around alcoholism for that particular individual. So if you are just sharing a no audit trail proof of COVID health status, that's one model. If you are using this as an opportunity to collect and collect for audit purposes ostensibly, but then someone will say, well, we've got this data, can we then analyze it, anonymize it, aggregate it, and sell it on? Then you're going to get a potentially significant backlash against initially the presentation of the status. And if the presentation of the status gets kicked out because too many people are objecting to it, then you potentially, in the extreme case, also undermine the vaccination rollout or renewals or whatever it might be. So if handled badly, it can cause all sorts of unintended significant consequences. So it needs that real care about the use cases, the value proposition, and also very specifically what data you're sharing. Because of course, under GDPR and the UK equivalent, this is health data, special category data linked to you that needs to be treated a lot more carefully than photos of your breakfast or whatever it might be.
Thank you. Thank you for that, because I think that it's very interesting that there are dangers not just to offending people, citizens' views of their privacy, but also to actual public health if such systems are abused. So I'd like to take that question to Aine, because I guess by reputation, Estonian citizens have very high trust in government digital systems and have famously a mandatory citizen identity system, which removes some of the identity verification risks from public and private sector. So my question, Dr. Aaviksoo, is does this mean citizens have less fear in Estonia that their data is going to be used in ways that they wouldn't consent? What can we learn from that situation in the global context from the Estonian example?
Yeah, thank you. Indeed, maybe that is the reason why we are capable of also introducing the vaccination certificate in April. So both the government departments, all the legal people there, they have the experience similar to Estonian citizens for 17 years practicing digital services. But it has come with the experience, and part of that experience is transparency. And also with the certificates, I can see how a lot of effort is put into trying to, make this document as secure and privacy preserving as possible, whereas the whole use of the document, which in the case of Estonia, in most cases, whatever digital information is made available to the others, you as a citizen always know who has been using your data where, which means that as cyber criminals tell that you don't do cybercrime in Estonia because you get caught. And so I also believe that I can see how this EU proposal and also the WTO proposal, they are kind of converging towards the end that, well, we should make this privacy preserving at the point that you actually will only tell yes or no at the border, but also at the same time, you have no way to know who actually has processed the data after that. Which again, I think that the risk is, in one hand, we get a very limited value out of all this effort. And then on the other hand, as a citizen, I still may remain suspicious about it. So that one thing to learn is that, and that is also what Gartime has learned, not just in healthcare, but in many other domains. US government, Estonian government, a few others in Europe and elsewhere, they are using this information technology at scale. I'm thankful for Anthony pointing this out, that okay, now there is a use case that needs to work not just as a pilot, but really as something that you can build your business on it. So in those circumstances, the Estonian experience, but also Gartime's experience globally, tells that there are technologies that do scale, and part of that is that you kind of empower the citizens as guardians of that governance. So I'll finish. Somebody in Germany said, aha, a few years ago, telling, effectively, every Estonian is policing over all the others how their data is being used. So we don't need to blindly trust our data protection authority to make sure, but I as a citizen can hold anyone accountable. And that gives the power of the citizens to actually, trust if they are offered a digital service.
Thanks, Ein. And I think the mention of Anthony there, just very briefly turn to you, Anthony, I guess that there's been a lot of talking about sharing of health data, of security, of privacy, consent, and people on this seminar will have noted there's much mention of ledgers and blockchain and the job titles and the companies involved. Can you just say briefly, because I know you have excellent communication skills, what the role of ledgers and distributed ledger and blockchain might be in delivering some of the underlying privacy and consent concerns that we've noted today?
The short version is that you're using the idea of digital identities for issuers of credentials, for verifiers of credentials, to be able to transact or identify that a credential is current, active, and accurate. If you have a PDF with a QR code that's printed, a scanner is going to tell you that the information in that QR code matches what it expects to see. It's not necessarily going to tell you that it has been, that it is an active credential, that it is up to date, that it has not been revoked. And so while a lot of the solutions you're probably going to see come out first are available for mass consumption, they're oftentimes going to be required to have a secondary form of identity shown in addition to the piece of paper, or even if it's a digital proof with a QR code, without the decentralized identity or the platform behind it. Oftentimes you're going to be asking a citizen to show a second form of information to validate that, or in some cases a selfie, or show more information that they might not be comfortable to share. I don't want somebody knowing my date of birth or my address when I go into a pub. I'm not particularly happy that I have to write down my telephone number for contact tracing. If we can do that in an obfuscated way with a check-in type process or a pre-approval process, that system can exist on the platform with my identity and my wallet linked to it, such that I don't have to share more information than is needed, and the system only looks up what is required without sharing PII. That's the critical requirement here, but I'm not sure we're going to see that out of the gate, and that's what we've got to work towards.
Okay, thanks very much, Anthony. And then as we move into the last lap of this seminar, in the next, he says, removing his glasses to check the time in the last 5 minutes. So I'd like to just consider a point that was talked about earlier around the role of the private sector and public sector. Now, I personally know several individuals in my company's work in government who've worked absolutely tirelessly in public health and even specifically in some of the vaccine programs. And clearly in public health there's a central role in enabling some of this verification. We, on the other side, we see, I think, we see some of the solutions represented by the companies today, but countless other commercial initiatives covering the air industry and testing and so on. My concern, my question is really around what's the role of public and private sector in enabling some of the use cases that we have started to identify today. So I think in that context, my question to Maria, do you feel, Maria, there's a need for strong guidelines from the governments and the NGOs that we've talked about to guide innovation in the private sector, particularly in SMEs? Can you speak to that concern?
Yes, well, I think government should be involved in setting guidelines and not be shying away from the issue, to protect the best interests of the citizen. But actually, I think that the point of interest here is the need for collaboration actually between public health and the private sector, and particularly SMEs. I think it's an opportunity actually really to foster new relationships between these sectors, and I think there's a bit of a tendency to shrink away from private collaboration in public health, but there's an opportunity here to set standards for future collaboration. And obviously a stronger appetite to include SMEs in this process will lead to ongoing economic benefit. We've seen high-level guidance from the WHO, but the UK government response to this remains to be seen. So I think there's opportunity here for public health to be involved in creating actually distributed trust networks between public health, private testing and industry, where the citizen has oversight of what data is shared and when we're talking about a domestic use case. And that's what we've been focusing on at SICR.
Thanks very much, Maria. And with that, in painting that picture, I'll use the last 2 minutes of this event really to ask all of the panel in turn what their view is of the picture of the perfection. If we're seeing a burst of activity around the COVID crisis that's driven forward some of the digital solutions that can positively impact some of the citizen experiences that Anthony talked about earlier, what is your picture of perfection for the future role of technology in public health in the COVID pandemic and beyond? So I'll address that question first of all to Edgar, because he's on the left-hand side of my screen, and I know that he has a lecture very shortly. Edgar.
Okay, so rather than just focusing on a picture of perfection, I think there's a really interesting innovation question that's going to come out. So in the UK, the NHS is the source of truth about whether or not you've been vaccinated. It may not be the source of truth for antibodies or for testing, but for the vaccination, it's going to be there. If we are relying on vaccine, proof of vaccination as a standard activity, then the role of interoperability and standards for the relying parties, the bars, the restaurants, the theatres, or whatever, is going to be incredibly important, because you don't want to have to enroll with 7 different apps from 7 different SMEs for 7 different locations. The tension then, of course, becomes if any one app is as good as any of the others in terms of conveying the information, are we just going to get a homogenized service where there is no real competition, there's no real opportunity for companies to differentiate themselves? Or are we going to get a situation where one app provider, perhaps with a slightly slicker user experience or probably a better advertising campaign or a trusted brand, dominates the market, doing something fairly commodity in terms of providing that status? But if all this talk about innovation and SMEs and rebuilding the economy, perhaps goes a little bit to waste because of the nature of that standardized requirement for the technical exchange of data. So that's just my kind of random academic reaction to this.
Oh, thank you. Intriguing, Edgar. Perhaps an opportunity for big tech rather than SMEs. I'm turning to you. You're next to the left on my screen. What's your views of how this crisis might deliver some positive results out of the tragedy for in a picture of perfection for digital public health?
Yeah, most certainly, there will be lessons learned, both in the positive, from the positive outcomes as well as negative ones. So I believe contact tracing apps is one example where everybody had very great hopes, and then they built very, very secure systems, and then the public health benefit of those are, they're very limited. At the same time, I think at least in Estonia, and also there were some international collaborations that we participated, the level of collaboration between the tech industry and the public health officials and then others, I think that was unprecedented. So that I do think that the tech companies have learned a lot during this crisis, and the solutions that will come out of this will be, more considerate of all the complexity in healthcare. Sometimes I think tech companies take it, too easy, and sometimes also they have smaller and big fails. And on the practical terms, I believe that using your health data much more freely will be one of the outcomes. What exactly is the feature and the tool? I think we heard also from Anthony, we might not know exactly how it will materialize, but there will be certainly more freedom for people to use the data in a secure manner so that they can actually trust that the privacy will not be compromised.
Thank you, Ayn, and I'll quickly pass on to Anthony and ask him to stick to about a minute or so.
You're forever asking me to be brief, and I appreciate it. There's two things for me. Thing one is that we actually level up the infrastructure for data sharing and verification between member states. There are a number of protocols out there, trust over IP, a number of different self-sovereign identity, W3C verifiable credential standards that have been worked on for many years prior to the pandemic. Let's level up that capability around self-sovereign identity and credentials management at a national level. Thing two, and I think it's building on what Ayn said, let's try and see if we can build on that trust layer or that digital layer to enable open health to transform the experience for citizens in the same way as open banking did for financial literacy. So we're just starting to realize that it's a good thing for governments to play back our own health data to citizens. Right? I can't remember half of the interactions I've had with healthcare providers over the years, and I've had many different surgeries and strips and scratches. How can we start providing more open healthcare data to citizens in a privacy preserving way such that they can do more with that for their own benefit? I think that's a knock-on future implication of what we're uncovering in these last 12 months.
Thanks, Anthony. Open health like open banking, it's quite a vision. That leaves you with the last word, Marie-Lise.
No pressure then. It really just reflecting what the other panelists have said. I think COVID has rapidly accelerated the adoption of new technologies by large-scale health organisations such as the NHS, which has been traditionally quite slow to adopt any innovation. I think we just need to ensure that this isn't limited to the basics. So, of course, things like the rapid adoption of video consultations are great, but there's an opportunity here to deploy more innovative and impactful technologies to the likes of healthcare data management in order to bring healthcare in line with other industries and into the 21st century, essentially. I think this will ultimately improve things for healthcare professionals and public health, but most importantly, the individual. And it's up to government and public health to grasp the opportunity to innovate with industry and set the standard for easy, secure, citizen-led sharing and verification of health status, even beyond COVID. And that's certainly what we're hoping for and moving towards at SICR.
Thank you very much, Maria. So with that, I believe that we are 4 minutes over. And I think in the coming months, we're going to see many approaches and solutions and hopefully standards emerging. I want to give my heartfelt thanks to the panel today. I think we've found some really interesting things to talk about, and that we could have gone on for much longer. And perhaps we will have we will bring this group back together a little bit later as we see some developments in the areas that we've discussed. So thanks to the panel, thanks to the audience, and I'll let you get on with the rest of your day. Many thanks and goodbye.
Thank you.